second-year pre-nursing major from Omaha, Nebraska.
Hi, my name is Darren McBride. I'm a second-year pre-nursing major from Houston, Texas.
And today we're going to be talking about auscultating the heart and the lungs. And we're also going to give you a brief overview of the anatomy of the heart and the lungs and over normal heart sounds.
So here we have an anatomical picture of some lungs, and I just want to give you guys some reference of some of the anatomy of the lungs. So if you see coming down from the mouth, you have the trachea, and from the trachea, it splits off into two bronchi. Each of the bronchi one goes into the right lung and one goes into the left lung. The right lung has three lobes, the upper, middle, and lower lung, and on the left side you have just the upper and lower, so it can have a little nook for the heart back there. From the bronchi branch off into bronchioles that go to each individual lobe on the right and left lung. So when you're auscultating for the lungs, you're literally listening to one inspiration and one expiration per each lobe of the lung on both sides. In that little box down there, it's a picture of the bronchioles connecting to the alveoli. The alveoli are very, very important because they're responsible for gas exchange. When oxygen comes in through the mouth, it goes into the alveoli and transfuses over the membrane into the bloodstream. And carbon dioxide from the bloodstream transfuses over into the alveoli and is expelled through the mouth. So those are very, very important.
Hi, so now I'm going to show you how to auscultate for lung sounds. So when you're auscultating for lung sounds, normally you're going to want to use the diaphragm of the stethoscope and you're going to want to use it on the skin, but we're not going to do that today. I'm just going to show you on her shirt with the little stickers where you will be auscultating. So first we're going to start with the apex of the lungs, which is at the top, mid-clavicular mid-clavicular in these spots right here. You're going to start on the right side, listen to one inspiration, one expiration, and then you're going to move to the left side. Then you're going to go down to the second intercostal space, mid-clavicular, and you're going to listen to one inspiration and one expiration. Then you're going to move on to the right side, and you're going to, in the second intercostal space, one inspiration, one expiration, to the third intercostal space, and you're going to listen to one inspiration, one expiration, and then you're going to go to the third intercostal space on the right side. You're going to go down to the fourth intercostal space, and what's notable about the fourth intercostal space, on the left side, you're still listening to the upper lobes of the heart. Everything from the fourth and up, you're listening to the upper lobes of the heart. But when you go on the right side of the fourth intercostal space, you're listening to that middle lobe that we talked about earlier. Remember, the right side has three lobes, upper, middle, lower, and the left side has two, upper and lower lobe. So you're listening to the middle lobe on the right side. On the left side, you're still listening to the upper lobe. You're going to go down to the fifth intercostal space, and you're still listening to that middle lobe on the right side, and then you're going to go to the left side. Now you're getting into the lower lobes on the interior side of the body. So when you go down to the sixth intercostal space, you're listening to the lower lobes on the left side. The lower lobe on the right side, you're still waiting for that inhale and exhale. You're going to go down to the seventh intercostal space, mid-clavicular, so seventh intercostal space. So now we're going to look at the posterior side of the body to listen to the lungs. The anterior side, you're more so listening to the upper lobes of the lungs. On the back side, you're mostly listening to the lower. So you're going to start from your right again, and you're right above the scapula, listening to the apex of the heart again. So you're going to inspiration, one expiration, both sides. You're going to move down so when you're doing the back, you're looking at the auscultation sites in relation to the spine. So you're going to listen in between cervical C7 to T3. And those are still the upper lobes of the heart. But then once you go towards these last five, towards the bottom, these last auscultation sites, T3 to T10, you are listening for the lower side of the heart. And the bottom two in the sixth and seventh intercostal spaces, they're mid-axillary as well.
Here's an anatomical picture of the heart. I just wanted to note some of the structures in the heart because we will be listening to them. So you have the right atrium and the right ventricle right under it. In between them, you have the tricuspid valve. From the right ventricle, you have the pulmonic valve that leads to the pulmonary artery. You have the pulmonary veins coming in from the side into the left atrium, which then flow through the mitral valve or the bicuspid valve, and then onto the left ventricle, and then passing the aortic valve into the aorta. So when you're auscultating for these heart sounds, what you are looking for is a lub-dub sound. The lub sound is called S1, and that S1 sound is the tricuspid and the mitral valves closing. The dub sound is S2, and it is the aortic and the pulmonary valves closing. So when you're listening to the heart sounds, that is what you're hearing for: lub-dub, 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 S1 and 2.
Today we're going to be auscultating the heart sounds, and we're going to be listening for normal heart sounds. And the normal heart sounds are the lub-dub of the S1 and S2 sounds, and that's the closing of the tricuspid and mitral valves for the S1 sounds. And then for the S2 sounds, we're listening for the closing of the aortic and pulmonic valves. And to auscultate, we're going to start with the aortic, which is in the second intercostal space, which is the right of the sternal border over here. And we're going to use this side. And then right across from that, we're going to listen for the pulmonic, which is in the second intercostal space, which is left of the sternal border right there. And then right after that, we're going to go down, and we're going to go to the Erb's point, which is in the third intercostal space, which is left sternal of the border. And then right after that, we're going to go down to the fourth intercostal space, and we're going to listen right there, which is in the left sternal border, or left of the sternal border. And then we're going to go right here to the mitral, and that is the mid-clavicular, or is in the mid-clavicular fifth intercostal space.